We are going to do a practice. Everybody's going to do it. You can sit if you wish to. You can stand as well. We did this morning some. And the deep breathing involves the diaphragm. The diaphragm is a big muscle below the lungs. And newborns, they breathe diaphragmatically. When you were born, you were breathing in this way, really deep. Over the years, we distorted the breathing because of tight clothing, because of stress of life, and we start to breathe shallowly and in the upper chest or in the middle chest. This is not the correct breathing because the lungs are much bigger on the bottom part. Then we need to breathe on the bottom of the lungs to draw more oxygen. And this is what we know about breathing. We will be able to draw more oxygen when you breathe deeply. However, for you guys and for the lymphatic system, there is a major advantage. When you breathe deeply, the diaphragm moves up and down. When you breathe in, the diaphragm goes down because the lungs are two inert sacs. They cannot bring air inside themselves. The muscle does this, and this is the diaphragm in charge of 75% of the inhalation. When you breathe in, the diaphragm goes down to pull the air inside the lungs. When you exhale, the diaphragm lifts and squeezes the lung. Then this motion up and down of the diaphragm will massage the internal organs. It's not only bringing more oxygen to you, but it's pumping the lymph from the legs, from the abdominal area, towards the heart. The lymph fluid has to return to the heart. The heart does not pump this liquid. The heart pumps the blood, but not the lymph fluid. The lymph fluid is ignored by the heart. You are the one that have to pump the lymph fluid. And the two major pumps for the lymph fluid is breathing, but motion with the diaphragm is not shallow breathing. Shallow breathing will not do the job. And this motion with the muscles. These are the two major factors that will pump your lymph towards the heart. Breathing and motion with the muscles. Then now you know why you need to breathe deeply. You are going to pump the lymph fluid from the legs. Let's start rubbing both hands first. We need to work with the brainstem or the neck. I will say different things for those that were here in the morning, not to be boring for you. I have been teaching yoga for 30 years, and I know a lot, let's say like that. I'm MOT therapist. I graduated in Austria, and I am a CDT with Dr. Folt in Germany. Let's bring the hands to the neck, please. And we are going to press and release the air of the neck alternately, but be gentle with yourself. There is no forcing, no violence. If you are not gentle with yourself, who is going to be? Then be very gentle with yourself, pressing and releasing it, just to increase circulation there. Now between the neck and shoulders, pressing and releasing it, pressing and releasing it. Now breathe. You are holding your breath. Yes. Remember to breathe. Avoid holding your breath, because then you cannot pump anything there. And the stagnation, the sluggishness of the lymph will happen. The lymph is rich in protein, and the protein will harden when it's not moving. If the lymph is not moving, the protein will harden the tissues, and then it becomes even harder to move. Bring your hands together, please. Inhale, lift them. Breathing in, press your hands between the shoulder blades, keep the pressure. Exhale, drag your hands to the collarbone, shake them out. Let's do it again. Inhale, lift. Breathing in. Press your hands between the shoulder blades, keep the pressure. Exhale, drag your hands to the collarbone, shake them out. Let's do once more. Inhale, lift. And press. Exhale, drag your hands to the collarbone, shake them out. Now, as you breathe in, lift your shoulders before we do our diaphragmatic breathing. Exhale with a sigh and drop them. Then we are going to exhale through the mouth. This is an exception. Usually it's in and out through the nose. Inhale, lift, breathing in through the nose. Shoulders higher. Exhale with a sigh. One more time. Breathing in, lift. Now towards the sky, a little higher, 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 higher. Now round your back and drop your head, just to move the spinal column, to make sure that the diaphragm is going to work properly for you. Breathing in, lift your spine. Chin to the ceiling, squeeze your shoulder blades together and open your heart. Exhale, shoulders forward. We are opening the lungs. Drop your head. Inhale through the nose. Synchronize breath and motion. Stacking up the vertebrae. Chin up, lips apart. Open your heart. Exhale, shoulders forward. Collapsing the trunk. Drop your head. And let's do one more time. Breathe in fresh, vital oxygen. Breathing in pure energy. Squeeze your shoulder blades. Hold the air, please. Lift your heart higher now. And as you exhale, shoulders forwards and drop your head. And remember to squeeze the abdomen at the end to throw out all residual air. Now bring your back to a neutral position, head in line with the spine. Let's use the fingertips, 4 fingers in each hand to tap below the collarbones. Breathing in and out through the nose. This morning I also spoke about the newly discovered lymph vessels in the brain. We worked with them a lot to prevent brain fog or to improve the condition, and also mental confusion, forgetfulness, and preventing Alzheimer's and Parkinson's as well. Now only the right hand on the sternum bone, up and down, up and down, up and down, the breastbone, breastbone. Now gently shake both hands out. Inhale, let's lift the arms, everybody. Breathe in, opening the lungs, breathing in. Exhale, gently twist to the right and lower the arms and bring to your side, if you are in the chair, to the thigh. Inhale, lift again. Breathing in, breathing in. Exhale to the other side and look over the shoulder, far behind you. Inhale, arms up, breathing in, breathing in. Exhale, look over your right shoulder and squeeze the abdomen at the end of this exhalation. Relax the abdomen. Inhale, up. Exhale, now squeeze the abdomen. The exhalation is more important than the inhalation. Inhale, lift, breathing in, hold the air, hold the arms, hold it. Exhale, you did very good. Look over the shoulder, far behind you. And breathing in, lift the arms, breathing in, hold the air, please, hold. Exhale, let's lower the arms. And let's shake, those that are standing, shake your legs as well. And let's bring the right hand to the navel. We all can sit now. It's going to be easier to breathe diaphragmatically if you have a seat. Then, over the years, we distorted the breathing. We usually are breathing in the upper chest or the middle chest, and we are using the intercostals. When we breathe here, we are not really engaging the diaphragm. The diaphragm is the one that sucks the lymph from the legs, from the abdominal area. If you use the intercostals, tiny muscles in between the vertebrae, when you breathe in the upper chest and the shoulders, moving the shoulders, you are using the intercostals. This is not good. Then keep your shoulders without motion. Now, if you do like this, the air comes here, and then you cannot bring the air down to the bottom of the lungs anymore. Then major thing, keeping your shoulders down. Avoid moving your ribs, no intercostals. Right hand on the navel, just to make sure that the navel, it's your focal point that will tell you if you are moving the diaphragm or not. It's your clue. Then think of your navel. Exhale. Start with the exhalation. Exhale, navel goes towards the spine. And this will pump the lymph throughout the entire body, not only the legs. Breathing in, navel moves forward. This rejuvenates your body. No shoulders, shoulders down. Exhale, think of your navel. Now squeeze. Squeeze more the navel towards the spine, throwing out all residual air. Relax the abdomen. Inhale, navel moves forward. You can imagine that you have a party balloon in the abdomen. Blow your balloon slowly. Exhale, deflate this balloon. And now squeeze more the abdomen. Relax the abdomen. Breathing in a little deeper now, closer to the hip joints. Lower abdomen also moves. See if you can do this. Exhale. Bring your navel towards the spine. And now squeeze more. One more time. Inhale. Navel moves forward. Breathe closer. No chest motion, please. Exhale, become aware of your chest. Relax your jaw. The jaw is not working. Relax your lips. Very good. Shake both hands out. We are going to cup the right hand and tap the opposite shoulder, shoulder blades. Breathing in and out through the nose as deeply as you can. And the arm. And this helps your digestion. The only thing that you can do after digestion, according to yoga concepts, It's breathing. You should not do any yoga motion, but breathing will help you to digest the food, will help you, let's shift to the other side, will help you to absorb better the nutrients of the food as well. Then it's good that we are doing now this breathing. And now, again, let's tap below the armpit. A bunch of lymph nodes there. And I believe that I forgot the other side, to insist in the other side, and then let's insist in the other side. We don't pay attention to these areas. And the lymph fluid from the legs are coming here. This is very important for you to know. Now shake both hands out. Let's see if it's a little easier now. Exhale. Start with an exhalation. Exhale, exhale. Navel towards the spine. Now breathe in slowly, slowly. Navel moves, no shoulders, no shoulders. Navel moves forward. Exhale, slowly deflate your balloon. It's not only breathing deeply, it's also starting to lengthen the time of inhalation and exhalation. Breathe in slowly, navel moves forward, like a party balloon. Hold the air momentarily. Exhale, control this exhalation, control. Gradually squeeze the navel towards the spine. Let's do again. Inhale slowly. Think of your navel. If the mind goes away, the shoulders will move because we are conditioned to breathe shallowly. Exhale, think of your navel. Bring your navel towards the spine. Squeeze more. Let's do just one more breath. Slower at your own rhythm. The slowest that you can without being out of air. Exhale, control the exhalation. Squeeze the abdomen. Squeeze the abdomen. Very good. Bring your right hand, shake them out, and let's do it again. Both hands together. Inhale, lift them. Breathe in, press your hands between the shoulder blades, keep the pressure. Exhale, drag them to the collarbone, shake them out. Tomorrow morning, we are going to do things that we didn't do today, the same things and more things, but tomorrow I'm going to use this breathing and another breathing because the diaphragm should be a little more flexible. Then I can move forward. Then we will do another breathing to even suck better the lymph. I would like you to close the eyes just for 1 minute or two. Gently close the eyes. Bring your attention to your body. As we close the eyes, we avoid the distractions from the outside. Exhale, tuck your chin in and slowly lower your head. And feel what's going on in your body. Keep the attention inside. Breathe in, lift your chin. Breathe in, chin towards the ceiling. Breathe in deeply as you were doing before. Relax your lips. They are not working now. Exhale, head in line with the spine. Tuck your chin in and drop your head again. Now, bring your head in line with the spine. Keep your spine straight. Shoulders back and down. Close your eyes and relax your shoulders. Keep your eyes closed. And mentally observe the sensations that were triggered in the body because of the simple techniques that we did. Your body is restoring now. Your body is recovering. You can feel sensations spreading throughout the entire body if you are aware. If your mind is not distracted, relax more your shoulders, relax your lips. The lymph fluid is now moving away the toxins from the cells and allowing the cells to absorb better the nutrients. The lymph fluid is the sewer of the body. It's also, because of the convention that Dr. Fold established, the interstitial liquids, the plasma and the lymph are all the same liquids. Depending on the location, they have different names. And as a convention, we use lymph for all of them. The plasma leaks from the blood capillaries, whitish liquids, and envelops the cells. Then it's not called plasma anymore. It's called interstitial liquid. When the interstitial is absorbed by the lymph, then it's lymph fluid. It's all the same liquids. Now the liquid is moving, nourishing the cells, and also moving away the toxins for them to restore, to bring balance to you physically, mentally, and emotionally. They are all together and they affect each other. Body, mind, and emotions. We work with the body, that is the thing that we can see, to reach the things that we cannot see, the mind and emotional levels. You can open the eyes. Thank you so much, and hope that you can come tomorrow morning. It's early, but it's worth it, 6:45. Thank you. Thank you.